and welcome to How to Gastro. In today's video, we're going to be speaking about a very interesting topic, and that is bronchiolitis. So let's get started. So what is bronchiolitis? Bronchiolitis is an infection of the respiratory tract. It occurs when the tiny airways in our lungs, which are called the bronchioles, get infected with a specific virus. When the bronchioles become infected or damaged, they swell up and become clogged, which in turn blocks the flow of oxygen. Bronchiolitis occurs most often in children under the age of 2, during winter and early spring, and very seldomly affects adults. So from this definition of bronchiolitis, we get that it's actually the inflammation or infection of the bronchial system of the respiratory tract. And the disease most commonly affects infants, usually children under the age of 2, especially during the winter and early spring. So the main cause of bronchiolitis is actually a viral infection, and we'll see later on in this presentation which specific viruses can be involved. And when these bronchioles become infected with these specific viruses, they actually swell up and inflame and actually narrow the airway space or clog up and thereby block the flow of oxygen, which is of course quite debilitating to these patients. So now that we know what the basics of bronchiolitis is, let's take a closer look at how one contracts the disease. So 90% of bronchiolitis cases are caused by a virus known as the respiratory syncytial virus, or RSV, which is spread through tiny droplets of liquid from coughs or sneezes of someone who's infected to somebody else who's uninfected. And this is how one can actually contract the disease. So viral outbreaks usually occur every winter and usually affect children under the age of 1 year old. And the remaining 10% of cases are usually caused by the adenoviruses. So now let's explore some signs and symptoms of bronchiolitis. So for the first few days, the following symptoms are present: a runny nose, a stuffy nose, a cough, and a slight fever. And this may not always be present. After this, there may be a week or more of a difficulty in breathing or a whistling noise when the child breathes out, which is sort of like a wheeze. Many infants also have an ear infection which accompany this infection, which is called an otitis media infection. So these children will have that runny or stuffy nose, cough, sometimes a fever, an expiratory wheeze, and the difficulty in breathing. The diagnosis of bronchiolitis. So the diagnosis of bronchiolitis is based on the clinical presentation of the infant, which includes the runny and stuffy nose, the cough, and the slight fever. And doctors will also listen with a stethoscope to check for any crackling or high-pitched wheezing, which may come from the child's chest during auscultation. And lastly, they will also check for the oxygen levels with a pulse oximeter. So usually these children have a low oxygen saturation, because as we can imagine, if that bronchiole is inflamed, it's going to be really tight and it's going to cause a block in the flow of oxygen compared to a normal healthy bronchiole. And this is why the oxygen saturation levels will usually be lower than normal in these patients. And finally, the treatment of bronchiolitis. So many cases of viral bronchiolitis are mild and clear up without treatment. For more severe cases in infants, hospitalization may be necessary. The hospital will provide oxygen, a nebulizer, which helps loosen the mucus in the airway and relieve cough and congestion, and intravenous fluid treatments, which will prevent dehydration in these patients. And that brings us to the end of this video on bronchiolitis. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure to turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.